Caroline Fisher.
This seems like the better microphone.
I've noticed that, actually, recently.
Representative Gelser, Committee. I'm Dr. Caroline Fisher. I'm a resident of Benton County, Corvallis, Oregon. I'm speaking in support of 2756 technically as a private citizen, although I am the head of child psychiatry at Good Samaritan Regional Medical Center and a board-certified child and adolescent psychiatrist. In my professional life, I have inspected a variety of facilities, mental health facilities for children with developmental disabilities, for children with psychiatric disabilities, schools and residential facilities. I have worked in them, and I have run a few. And in the course of my work, I've worked with kids with both severe developmental disabilities and severe psychiatric disabilities, and both at the same time. I have been hit, kicked, cussed out, spat at, and choked by some of my patients. So I am not unfamiliar with aggressive kids. The school systems have really lagged behind the mental health community. The psychiatric facilities have been working towards zero restraint and seclusion for a number of years at this point. And in one of my guises, in one of my past lives, I was the medical director of a unit that went from having 6 or 7 seclusions a day to 1 a month. And in the course of that transition, I heard all the same arguments you probably have already heard, that it won't be safe, that it'll be bad for the kids, that it will cause more injury, that the kids need it, that this is a valuable intervention. And what happened in our unit, and what has happened kind of across the units that I have been involved with, who have gone from using seclusion on a regular basis to using seclusion in very rare circumstances, is this. This is pretty standard. What we got was better staff satisfaction, fewer staff injuries, fewer patient injuries, better morale among staff, and better morale among kids, and an overall calmer milieu. That's what we got. We also got better, more effective behavior plans because people were working harder at them. And the reason for that is that seclusion is traumatizing to the child who is secluded. And some kids take it better, some kids take it worse. But many kids are really quite traumatized. It's also traumatizing, or can be traumatizing, to the kids who witness the seclusion. So even the kids who are not aggressive and not aggressively acting out and not being secluded can experience vicarious traumatization. I'd like to read to you an excerpt from an email I got from a mother of one of my current patients. She has fetal alcohol syndrome and has developmental disabilities. Her mother is asking me, could her current school difficulties 2 years after this incident be related to post-traumatic stress disorder from this incident? She writes, "It wasn't until she was in 1st grade and she spit on the secretary." Now, keep in mind, this is the imminent danger, right? She spat on an adult, little six-year-old spat on an adult. That she was walked down to a small padded blue room inside the transition room that had no exit or windows and a mesh roof. She went crazy inside the room, stripped naked, and was frantically trying to scale the walls and get out. She would throw her shoes out the only opening. 3 adults were standing against the door and wouldn't let her out. She kept screaming for me, cussing at them, shrieking, "Out, out, out, out," and trying to spit out the little opening at the adults standing there. They would call me. There were 3 incidents, the last one for over an hour, and I'd asked them not to do it again, and the principal videotaped her on his iPhone. They removed her from the padded cell and decided to put her in a small room the next time she started to demand to come home and was spitting, and basically held the doorknob shut. The rest of the year was written off. They wouldn't allow her to come to school because when she came, she would lose it. She'd want to come home, do anything to get there, running away when possible, cussing, spitting. Last week we were in the reset room. That's the quiet room you may have heard, of the rest room. at her current school, and she said it reminded her of the Blue Room. She wasn't in trouble, she was just chilling, and said how much it reminded her of the Blue Room. Yesterday, she went into meltdown at school with a panic attack, and then had flashbacks. The same teacher who was at the old school and witnessed 2 of the Blue Room incidents and was horrified is her current special education teacher. She said 75% of what she recounted was 100% accurate. She described the room, the people there, what happened in there, etc. During this flashback, she was sobbing and saying, I couldn't breathe in there. They wouldn't let me out. I was trapped. There was no door. They just threw me in there. She went on for some time in flashback, and I believe it is documented. Last night she had nightmares and, of course, won't sleep alone. In my experience, seclusion is often used as punishment. Spitting on an adult is not imminent danger. And as in the examples you've heard today, there's nothing in the medical literature that confirms any benefit in the use of seclusion. Mental health professional organization guidelines and government regulations do not consider seclusion as a therapeutic modality. House Bill 2756 prohibits the use of just one form of seclusion, the most severe. There's no particular reason that this needs to be used. And I guess I'd like to plant the seed that there's no particular reason that seclusion needs to be used at all. Any questions?
Thank you. Are there any questions for Dr. Fisher?
Fair enough.
Thank you very much. And I would just point out for you may hear of Dr. Fisher, who is Representative Springer has Lebanon. Yes. And Lebanon High School is doing the mental health screening. Dr. Fisher is kind of kicking that off. Oh. Representative Huffman.
Thank you, Madam Chair. You almost slipped away, but I did think of a question. In your professional opinion, how many, or what's the likelihood of a child like this that spits on an adult and is the situation's inappropriately handled as you described? You've got the trauma, the leftover from that. How does it affect the child moving forward? I'm thinking of in particular child that I know that when you deal with that child in a responsible manner, and you don't lock her in a room or a closet or something, she comes back around fairly quickly. But this same child, if you dealt with her in a different manner, I could easily see the behavior being made worse. Is that the point you're getting to?
That's what we found on the inpatient unit. The sort of common wisdom was that you set the limit, you say this is not going to happen, you put the child in seclusion, and that stops the behavior. But in a lot of children, what that does is it exacerbates the agitation. And if they have a history of trauma in other circumstances, they go really into a fight or flight mode. And most of our kids that wind up in the inpatient unit have fight mode down pretty well. And so it creates a cycle of aggressive interactions where they're now thinking about how they can get back at the staff for having done that, rather than stopping the behavior, giving them a substitute behavior, and moving on.
Representative Gorsuch. Oh, wait, no. Representative Huffman.
Just to follow, and I was really focused in on the little girl story. I'm not judging anybody. I could understand that there might be older kids that could be more frightening, and it's more than spitting. So I didn't want to oversimplify the situation either.
And just, you mentioned little girl. What was the age of the little girl?
She was 6 when she was put into that seclusion. She's now 8.
Thank you. Representative Gorsuch.
Does an issue like this tie into the fact that we don't have enough mental health professionals in education, and that we don't have enough training of staff to deal with these things in a perhaps a different modality?
I would say, now I'm biased.
I know,
Okay.
yes.
I am biased. We don't have enough school counselors, unquestionably. We don't have enough school psychologists who are able to do functional behavior analysis. We don't have enough training. We also just flat out don't have enough stuff in our schools. We have taken ill care of our schools. We really should be working much harder to protect our children by giving them enough teachers, enough resources, enough everything.
Thank you. Thank you.
Are there any other questions for Dr. Fisher? And I have one more. So this bill is specifically, again, about these seclusion units or cells, and you've seen the photograph of it, or the idea that we're getting at. In your experience, are these being used in actual mental health facilities in Oregon?
I have never seen one used in a mental health facility that looks like that. Seclusion rooms certainly are used. The big button that requires staff to be there is actually a safety feature so that the staff can't walk away, because the previous iteration, people would lock the kid in and go do something else, forget about the kid. So by holding the big red button, you sort of forces somebody to be there. But I have not seen these units, these tiny little cells, in a mental health facility ever, here or anywhere else.
Representative Gorsuch.
Just as a comment, nor have I seen those sorts of things used in a county jail facility. Separation cells are full-sized cell rooms, and the staff has a window and they check constantly. So, I mean, if we can't even do it as well as they do in a correctional facility, there's a problem.
Any further questions? All right, thank you very much.